So in the 90 seconds that they actually give us, so as you already know, like we have to kind of underline or decide what are the key information that the tape is trying to give us. Okay. And for that purpose, we'll see what impressed Dr. Gibbons about the case study that was sent to him. Okay. What impressed about the case study, like that. Okay. And where published, how controversial, and colleagues' reasons for sending. Colleagues' reasons for sending. So these are the key words for us for this particular question, like that. Okay. Well, 38, Gibbons noticed. So Dr. Gibbons noticed people who read books. Okay, people who read books gain insight, see improvement, benefit from change. Benefit from change in behavior. So this is also important here. So this keyword identification in 90 seconds is very important for us, like that. And also we will have to see disadvantage doctors identify. Disadvantage doctors using patient stories identify. What is that? Like that. Okay. So this research being disregarded. Okay. And patients encouraged to self-diagnose. Okay. And tendency to jump to conclusions. Tendency to conclusions, like that. And next one, in Gibbons' opinion, why? So any WH question has to be highlighted by default. Okay, why these stories inform medical practice? Okay, why should patients' stories inform medical practice? Because they provide insight, they prove useful, more accessible. So we just need to see whether they are talking about providing insight or proving useful or more accessible, whichever is convenient, like that. Okay, that's exactly how it is. And 41, how does Gibbons feel? Okay, how does Gibbons feel about randomized trials? Okay, medical, yes, it's of course by default anything that is discussed here is medical, so that we don't have to focus completely on that. Okay, but what is important for us is to understand the fact that we need to see the use of how we feel randomized trials. He questions about the reliability. He is suspicious about the way data is selected. Okay, he is doubtful of their value when used independently. Okay, whether he questions, whether he is suspicious, whether he is doubtful. So what is it? Let's see. So when talking about narratives, okay, Dr. Gibbons reveals his determination, his commitment, his optimism. All three words are pretty much similar. When you say determination or commitment, is determined, he is committed. Both are same. Okay. They should be used to inform research. Inform research. Commitment to widely accepted. Commitment of making them widely accepted. Optimism that they will be published widely. Is it about publishing it? Is it about making acceptable? Is it about using them to inform research? Okay. So all of this has to quickly happen in the 90 seconds. That's 1.5 minutes, which is in fact given to us ideally. Okay, that's how it is. Well, so now I'm going to play the tape here. Okay, and thereafter, yes. Okay, and here we would try it in a similar way like how we did earlier, where we focused on the synonyms that actually the tape used in order to tell us what the question was about and what answers that we are supposed to select in there. Okay, right. And I'm going to write the synonyms here. Okay, and we will discuss how perfectly they help like that. Okay, because here it's mostly mainly about selecting the synonyms, plus at the same time comprehending what it is trying to tell us. Okay, well, I'm going to start. And meanwhile, if any questions or doubts or something, so just always unmute and ask. Okay. Well,
Occupational English. Hello, my name's Anthony Gibbons. I'm a clinical psychiatrist and published author. I'd like to talk about something that's relevant to all medical professionals, the use of narratives in medicine. Let me begin with a case study sent to me by a colleague who shares my interest in the subject. The study featured a 30-year-old man who was hospitalised for severe panic attacks. He was treated with narcoanalysis, but feeling no relief, turned to alcohol and endured years of depression and social isolation. 4 decades later, he was back in the psychiatric system, but for the first time he was prescribed the antidepressant Zoloft. 6 weeks later, he was discharged because the panic attacks and depression had disappeared. He lived a full life until his death 19 years later. If the narrative was striking, it was even more so for its inclusion in a medical journal. Repeatedly, I've been surprised by the impact that even lightly sketched case histories can have on readers. In my first book, I wrote about personality and how it might change.
okay, here it says, I was quite surprised about. So the moment he talked about quite surprised how people can be influenced. Okay, so then he would go to question number 38 in that. Okay. However, about question number 37, okay, he mentioned a couple of things. So the first thing that he did here was to talk about the overall case study. I mean, the details of the case study. Okay, I mean, what was the case about? I hope you heard it. I hope all of you heard the tape, by the way. Please confirm. Hello.
Yes, sir.
Yes, okay, yeah. And this details of the case study was not required to us. I mean, we don't need it. Okay, what we need is what impressed him. Okay, what impressed him. And in order to tell us what impressed, so after giving us details about the case study, he gave us the word striking. What was striking was? So the word striking tells us that it has something to do with what impressed him, like that. Inclusion in the medical journal means this tells us that he is trying to talk about option A, like where it was originally published. It is inclusion in the medical journal. So medical journal is the place which he was trying to mention. Medical journal is a place which he was trying to mention, like where it is mentioned. But he didn't talk about how controversial it was. There was nothing about controversy as such, and colleagues' reasons for sending him. He just mentioned that, okay, my colleagues had sent to me, but why? That was not mentioned. Understood? Yeah, and if you could unmute and if we could discuss things, it would be more interesting. Yeah, you don't have to mute all the time like that because I need to confirm whether you actually understood it or not. Okay, so I hope this 37th is clear. Okay, fine. Okay, I'll move on with the next one. Okay, so the word inclusion in medical journal confirms to us that it is option A because medical journal is determining the word where it was published. So published is a synonym of inclusion. So we have to go by the synonyms here like that. Okay, that's the thing. Okay, so I'm going to go next. Noticed people who read his books get insights, improvement, change in the behavior. Okay, let's see.
On medication. My second was concerned with theories of intimacy. Readers, however, often use the books for a different purpose, identifying depression. Regularly, I received and still receive phone calls, people saying, "My husband's just like X," one figure from a clinical example. Other readers wrote to say that they'd recognised themselves. Seeing that they weren't alone gave them hope. Encouragement is another benefit of case description, familiar to us in an age when everyone's writing their biography. But this isn't to say that stories are a panacea to issues inherent in treating patients, and they
Yes. So for 38, okay, he said a couple of things like what happens to the books, to the readers who read his books. Okay. And when he talks about it doesn't mean that it gives only advantage. So it means that he is going to talk about the disadvantage of doctors using to identify. So he is moving on to 39 when he says that. But earlier to this, he said readers identify the problems, okay, and depressions, and people recognize themselves. Okay, so many patients told him that they could recognize themselves and they get encouragement. Okay, like that. So this actually, like recognize themselves or encouragement, these words help them understand that they gain more insights into their mental health problems. Okay, see here why B or C can't be the option, because B, he didn't say any improvement of his patients in the personal relationships. The tape was more about individual improvements, not about relationship improvement. I hope you heard that part again. Okay. And benefit from a change in behavior, subtle change in behavior. Okay. So change in behavior was not the thing where, because he said recognize themselves. They could recognize themselves. Okay. Means depression is a synonym of mental health problem here. Okay. Gain insight means the synonym of recognize themselves. And they also get encouragement for that. So there is no change in the behavior. Okay. By reading his books, they are only able to recognize themselves. They're not yet to change completely. Okay. So I hope that is clear.
Yeah.
Yes, sir.
Okay, so that is how part C is ideally. And making notes like this, the way we are doing now, can really help a lot in a great extent like that. Okay, well, 39. What disadvantage of doctors using patient stories does Gibbons identify? What disadvantage of doctors does Gibbons identify? Okay, so focus on the word disadvantage like that. So research disregarded, patients encouraged for self-diagnosis, tendency to jump to conclusions. Let's see what it is.
Can be disadvantages. Consider my experience prescribing Prozac. When certain patients reported feeling better than well after receiving it, I presented these examples first in essays for psychiatrists and then in my book, where I surrounded the narrative material with accounts of research. In time, my loosely supported descriptions led others to do controlled trials that confirmed the phenomenon. But doctors hadn't waited for those controlled trials. In advance, the better than well hypothesis had served as a tentative fact. Treating depression, colleagues looked out for personality change, even aimed for it, even though this wasn't my intended outcome. This brings me to my next point. Often, the knowledge that informs
Okay, so here he says clearly that it's reported better than well, and my loosely supported control on it. Okay, on the phenomenon, and doctors didn't wait for conclusions. They didn't wait for conclusions. Okay, and what they thought was actually not my intended conclusion. So these are the words that he said in the tape, which is clearly pointing out towards one option. I know what is it? Any guesses?
A.
No. Is being disregarded. They didn't disregard it. They considered it actually. They didn't disregard. The tendency to jump to conclusions. See here, he says doctors didn't wait for conclusions. They jumped to conclusions by themselves. And he said loosely supported control means it was not a solid one. So with whatever he did, they came to a conclusion that, okay, this is right, like that. Okay, so the disadvantage of doctors using patient stories is that they jump to conclusions with that. I hope it is clear.
Yes.
Yes,
Okay,
sir.
so that's the way the synonyms can really help. Ideally. Okay, well, so now let's see. 40. Dr. Gibbons' opinion, why should patient stories inform medical practice? Okay, why should patient stories inform medical practice? They provide insight, they prove useful, they are more accessible. Let's see.
clinical decisions emerges when you stand back from it, like an impressionist painting. What initially seems like randomly scattered information begins to come together, and what you see is the bigger picture. That's where the true worth of anecdote lies. Beyond its role as illustration, hypothesis builder, and low-level guidance for practice, storytelling can act as a modest counterbalance to a narrow focus on data. If we rely solely on evidence, we risk moving toward a monoculture, whereby patients and their afflictions become reduced to inanimate objects, a result I'd consider unfortunate, since there are many ways to influence people for the better. It's been my hope that while we wait for conclusive science, stories will preserve diversity in our theories of mind. My recent reading of outcome trials of antidepressants has strengthened my suspicion.
Yes. Okay. It begins to come together, true worth of anecdote and counterbalance. Okay. So why it's important? Because here, is it proving useful for testing new theories? New theories he didn't mention. Okay, he didn't mention about new theories. Okay, or he didn't mention about more accessible than statistics. He talked only about providing insight, okay, gain from numbers alone. Providing insight, or it actually gives us more words. So true worth of anecdote. That's what anecdote means, stories. Anecdote means the patient stories. So that is the synonym that we need to actually catch here, in fact. Okay, so more accessible in statistics. So statistics and numbers both are same here. But is he talking about more accessible and less accessible? That we need to see. Whereas he didn't talk about which is more accessible, which is less accessible. I hope it is clear, right? The use of grammar is pretty much clear here, ideally. Okay, yeah. Well, so I hope that's done. Okay, 41. How feel about randomized medical trials? Let's see. Questions, reliability, or suspicious way of data selected, and doubtful value independently. Okay, right. Let me play that.
The line between research and storytelling can be fuzzy. In medicine, randomized trials are rarely large enough to provide guidance on their own. Statisticians amalgamate many studies through a technique called meta-analysis. The first step of the process, deciding which data to include, colours the findings. Effectively, the numbers are narrative. Put simply, evidence-based medicine is judgment-based medicine, in which randomized trials are carefully assessed and given their due. I don't think we need to be embarrassed about this. Our substantial formal findings require integration. The danger is in pretending otherwise. I've long felt isolated in embracing the use of narratives in medicine, which is why I warm to the likelihood of narratives being used.
Okay, so it says numbers are narratives and evidence judgment. And he says randomized things are carefully done. So pretending otherwise. So he says when we use independently, it's only that we pretend otherwise. So he doubts the value of these. Okay, he doubts the value of them when we use independently. He doesn't question the reliability, or he is not suspicious about the selection of data. Okay, he doesn't talk about that either. He only talks about numbers are narratives, okay, and evidence-based judgment. But randomized trials are not like that, because the word randomized means it's randomly selected ones, like that. So he is doubtful about its value, like that. Okay. All right. 42. Okay, talking about narratives reveals determination, commitment, optimism. Let's see what it is.
Inform future medical judgments. It would be unfortunate if medicine moved fully to squeeze the art out of its science by marginalising the narrative. Stories aren't just better at capturing the bigger picture, but the smaller picture too. I'm thinking of the article about the depressed man given the drug Zoloft. The degree of transformation in the patient was just as impressive as the length of observation. No formal research can offer a 40-year lead-in or a 19-year follow-up. Few studies report on both symptoms and social progress. Research reduces information about many people. Narratives retain the texture of life in all its forms. We need storytelling, which is why I'll keep harping on about it until the message gets through.
Until the message gets through means commitment to making them more widely accepted. This last line helps us understand that. Okay, commitment to making them more widely accepted. So he says until message gets through. Okay, so his commitment is towards that. He wants to make sure that this narrative is accepted by everybody. Is determined that it should be used for informed research? No, that he doesn't say. That informed research should be used for that. And optimism that they will be published more widely. They will be published more widely, and commitment of making accepted. Okay, he didn't express optimism. He wanted to make sure that everybody would get that thing, like that. Okay, the last line he says confirms the answer to that. Okay, so this practice is something that we need. Okay, right. So that's how part C is. Okay, so we have discussed the full round circle of this one. Okay, and now I would want all of you to try this third test. Okay, of listening. Okay, the full test. In fact, it would take hardly about 40 minutes. Okay, just wanted to see after the discussions how like you would fare in the test. Okay, so here it starts. Let me tell you the page number. It's 144 in the book that I have shared. Okay, the tape link is also there in the same book. Okay, in the first page. Yeah, here it is. You can see 144. Okay, you can try it offline, not an issue. Once you're finished with that, please send me the answers. Okay, so that I would cross check and see how comfortable you were there. Okay, you can start now and you can finish it in 40 minutes and send me the answers. Okay, all of you. Right. Okay.
This, Hari,
Now, yes.
tape, like as we have practiced part A, part B, part C, we have to give pauses like that, and we have to take care of them.
Not pauses. Just try to do it at once without
At once, the full tape we have to listen.
At once. Yeah. Okay. The pauses are all recorded in the tape. You can try it as it is. Okay. And just wanted to see how much we get in the first round of that. Okay.
Okay.
Yeah. Okay. So you can start now. I'll sign off. And you can start the test now offline. Yeah. Okay. Bye. Go across things comfortably. In fact. Okay. Well, now the next one. So you see, has dash diet. What kind of diet? Let's see. So for a word has, what she uses.
Dial, I'm a vegetarian and I've never smoked.
Good.
I'm afraid I don't go to the
Yes. So what kind of diet?
Vegetarian.
Yes. Vegetarian. And as a synonym, she uses I am. I am means nothing but has. As a vegetarian diet, or I am vegetarian, like that. Okay. So you cannot expect the same words from the tape. Okay, that what is given in the questions. Okay, it's always in the form of synonyms here, like that. Clear? Okay, this is how it is. Well, and after that, needed dash treatment before the first pregnancy. Okay, needed dash treatment before first pregnancy. So what kind of treatment? Let's see that. Okay. Well, and what synonym she uses the word for needed. Okay, just focus on that.
or anything, but I walk to work and generally keep active.
Oh, that's good. So this is your first pregnancy?
No, I have a daughter called Ella. She's 3 now.
Ah, and did everything go smoothly that time?
There were no major problems during the pregnancy itself, but it took me quite a time to fall pregnant the first time. After having various tests, I was given some fertility drugs. Oh, what were they called? It's on the tip of my tongue. Never mind, it'll come back to me. This time, though, I didn't need any help.
Oh, it's no problem. What about labour?
Okay, so here she uses the fifth one. So what kind of treatment was it?
Fertility treatment.
Sorry?
Fertility treatment.
Yes, yes. Okay, and what synonym she used for needed? I was given. Right? She uses the word I was given. So I was given fertility treatment. Okay, I was given fertility treatment. This is something that is important for us, I think. Like that. Before the first pregnancy. Like that. Okay. Yeah. Now the sixth one, first baby presented as. Okay. Yeah. First baby presented as. Let's see what she says.
Last time round.
Oh, that was a nightmare. Though everything, thank goodness, worked out in the end. It was a breech birth. It looked as if I might have to have a cesarean, and I really didn't want that.
Yes.
Breech present.
Yes. Okay. So, and she used the synonym here. That is, it was. It was a breech birth. So, what does it refers to? It refers to the word first baby or first pregnancy. First pregnancy. So that's something which is important here. All right. So that is breach here. Okay. Now, seventh one. Dash required during intervention. Okay, that's required during intervention, like that. So what's required? So let's see what she says about requirement. Focus on the word required and the synonym that is used in the tape.
I was pleased I managed without an epidural too. They had to use forceps to get Ella out, but I didn't need any stitches, so that was okay. Unfortunately, though, I had some difficulties after the birth too. I was desperate to start breastfeeding, but
Yes.
Forceps.
Yes. Okay. Forceps. Like that. Okay. And for required, what synonym she used?
Used.
Need.
Needed. Okay. She used the word needed. Okay. So this is something that we need to really practice. Where? What word that was used as a synonym and how we can identify that. Okay, now after that, baby's father, a family history of. So until she comes to baby's father, you don't have to worry about the rest of the information. Okay, yeah, sorry, the 8th one is also there. After giving birth, had problems with. Okay, focus on the word problems. What synonym she uses the word problems for. Okay, let's see what it is. Right. Okay.
that didn't work out. At least not until I was given some guidance by the midwife.
Okay. So can I ask you about the baby's father?
Sure, that's my husband, Paul. That was a nightmare. Though everything, thank goodness, worked out in the end. It was a breech birth. It looked as if I might have to have a cesarean, and I really didn't want that. I was pleased I managed without an epidural, too. They had to use forceps to get Ella out, but I didn't need any stitches, so that was okay. Unfortunately, though, I had some difficulties after the birth, too. I was desperate to start breastfeeding, but that didn't work out. At least not until I was given some guidance.
Problems with?
Breastfeeding.
Yes.
Yeah.
Okay, I was desperate. Okay, and she also said that didn't work out. That didn't work out. Didn't work out is a synonym of the word problems. Okay, so this is something that we need to focus on. Didn't work out means problems. She had problems with breastfeeding. So the answer is breastfeeding. And when they paraphrase it, we should be successful in identifying that. Okay, well, so this is the case, which is important here. Well, now let's go to the 9th one. Okay, well, okay. The family history of. Okay, so what family history the baby's father has? Okay, so his family basically. Right, let's see that.
It's by the midwife.
Okay. So can I ask you about the baby's father?
Sure, that's my husband, Paul. There's something in his family history that I should tell you about, I think. His grandfather and father both had epilepsy, though he hasn't developed it himself. I'm not sure if that means he's...
Yes. What is it?
Epilepsy.
Yes. Right, and family history is father and
Grandfather.
both had epilepsy. Is it both? So it means the word both represents it as a family. Like that. Okay, so this is something as a family. So this is what we have to get used to. Ideally. Wonderful. The child from previous marriage has. Okay, so previous marriage, let's see what synonym is used here.
Children have a greater chance of having it or not. Oh, also, he has a child from his first marriage and she has Down syndrome, so he gets a bit anxious when I'm pregnant.
Yes.
Down syndrome.
Down syndrome.
Down syndrome.
Yes. Let me see.
Down syndrome.
Yes. Down syndrome. Right. And for the previous marriage, she used the synonym as
First marriage. First marriage.
Yes. That we have to identify. We should be able to identify the synonym for that. Yeah. Okay. Well, somebody has raised hand in the class. Who's this? Is it Geeta?
So some
Okay. Yes, Geeta?
disturbance is there, sir.
Yeah, there is some, this sound is coming up. Okay.
Yeah.
So, I don't know where it is. Let's see. Okay. Maybe just to avoid that, when the tape is on, maybe you can mute. Yeah. Okay. Now, till question number 10, we managed successfully with both synonyms as well as the answers. Okay. So while practicing, please do that. Now, inquired about the possibility of dash testing. What testing? Let's see that. So we will have to identify the synonym for inquired and possibility, both. Okay, let's see.
Oh, well, that's understandable, of course. We can discuss various testing options if you like. You might want to consider amniocentesis, for example.
But that carries a risk of miscarriage, doesn't it? I don't want to go for that. I've heard about another test called CVS. Is that something to consider?
Well, it's certainly an option. However, that procedure, in fact, also...
What is it?
CVS.
Yes. CVS. Is that something to consider? Right? So she also said, is that something to consider? Means this is the synonym of inquiring about the possibility. Like that. Okay, that's a synonym for CVS. Right? Okay. And 12th one, provided her with a leaflet on preparing dash for the new baby. Let's see. So focus on the word preparing. Leaflet would be same anyway. Let's see for preparing what he says.
So carries a small increase in the risk of miscarriage. And you'd need to come to a decision fairly soon because it's normally carried out between weeks 10 and 12 of the pregnancy.
Well, I can tell you straight away that if there's more risk, then I wouldn't consider it. I know my husband will feel the same.
Well, that's fair enough. So is there anything else you'd like to ask me about today?
Nothing urgent. But it'd be good to know more about how to get siblings ready for a new addition to the family. I want to make sure Ella doesn't feel threatened or replaced or anything.
Well, there's a leaflet that many parents find helpful. Here we are. Have a look through that.
Oh, thanks. That's great. I'm sure I'll have lots more questions at our next meeting.
Right. So what is the answer here?
Siblings.
Sibling. Right? Like that. So that's what we have to identify. Right? Okay, good. Well, so this is it. And for preparing, she said how to get ready. That's prepare, in fact. Okay. Well, so for 1 to 12, we have successfully done it for all these questions. Okay. And now this is how you need to practice initially until you get a good hold on identifying the correct answers, in fact. Okay. So this way you wouldn't lose any marks. Yeah. On the day of exam, the tape would be played at once, okay, for all the 12 questions. But while practicing, you can just do this in order to get used to the way the paraphrasing or the synonym is used, okay? Well, now let's move on to 13 to 24, okay? For this one, I would play all of this together at once, yeah? So what I want you to do is to find out the answers for these questions. Okay, that is 13 to 24. Okay, all of you. Now I will be playing the tape, and please make sure that you try to find out the answers, plus also the synonyms for the words as we did for the first tape. Okay.